Dear students, welcome back. In this session, we are going to see the dentition in relation to the temporomandibular joint. Okay, occlusion means contact of teeth on the both the jaws. Contact of teeth of the both jaws is called as occlusion. Okay, if you want to define in the dental context, it means simply the contact between the teeth. Technically, we can say it is the relationship between the maxillary and the mandibular teeth when they approach each other. That is called occlusion, or contact of teeth is intimately involved in the function of the temporomandibular joint. It is intimately involved in the function of the temporomandibular joint. So not only is chewing is one of the functions of the temporomandibular joint, but the contact of the upper and lower teeth limits the motion of temporomandibular joint. So if they come in contact, both the teeth of, that is the maxillary and mandibulary teeth, are come into contact, then it stops or limits the movement in the temporomandibular joint during empty mouth movements. When nothing is there in our mouth, that is during empty mouth movements. And the presence and the position of teeth. So the presence and the position of teeth are critical to the normal temporomandibular joint function. That means some people will have loss of teeth. Definitely there is an asymmetry in the chewing, isn't it? So which definitely causes some effect on the temporomandibular joint function. And also the position of the teeth. Some people, so normally the teeth has to be present in their sockets, isn't it? If some people will have an irregular presence of teeth, definitely what will happen, occlusion of those teeth will have some disturbances, so which will cause some disturbances in the movements of the temporomandibular joint function. Now we are going to see that one. So normal dentition. The normal adult dentition includes 32 teeth. For identification, they are divided into 4 quadrants. One is that is lower and upper, and so it is divided into central incisors, canines, molars and premolars. Okay, so the only teeth we will refer to by name or the upper and lower central incisors. So now we are going to consider the central incisors to understand the function of the temporomandibular joint. Okay, these are the central tooth of the maxilla and the central teeth of the mandible. So when the teeth are in firm approximation, that means when the teeth are firm approximation, that means when the teeth are coming contact. So when it is coming to contact means when the central incisors of both maxilla and the mandibular are come in contact, then that position is called as maximal intercuspation or the occlusal position. Maximal intercuspation or occlusal position. That means if you can see the tips of the teeth, you'll have some eminences. Okay, that eminences of teeth will come into contact with each other. So that is called as maximal. So that eminences are called as cusps. When these cusps of the teeth are come into contact with each other, that is called as firm approximation, and that position is called as maximal intercuspation. You can see here also it is the maximal intercuspation, where the maxillary and the mandibular teeth are come into contact. Okay, but this is not however this is not however the normal resting position of the mandible. Okay, this is not the normal resting position of the mandible. Okay, so but the normal resting position of the mandible, how can you say it is not? So when these teeth are come in contact, so the mandible will have some movement in the temporomandibular joint. That is not the resting position actually. So when it becomes resting position means, so when the upper teeth, okay, and the lower teeth, so the mandibular teeth with that of the maxillary teeth, so the mandibular teeth is present 1.5 to 5 millimeters behind the maxillary teeth, that means if the teeth of the two, that is the maxillary and mandible, is maintaining a space of 1.5 to 5 millimeters, then that position the mandible is at resting position. So by maintaining such kind of space, the intra-articular pressure within the joint is decreased, thereby decreasing the stress on the articular surfaces, and the tissues of the area are able to rest and repair. So here you can see, if two teeth are in contact, that means so forces occurs in pairs. So some forces are creating in between these two things, then what happens, that force is transmitted to the temporomandibular joint. So that means the force which is coming from this maxillary teeth is transmitted to where? Again to the joint. So that is, it increases the intra-articular pressure. Okay, if that space is maintained during movements, then the contact between the maxillary teeth and the mandibular teeth will not occur. Then there is a decrease in stress on the articular surfaces, and also the tissues of the area are able to rest. If there is any dysfunction is there, at this position it is going to repair as early as possible. So the maintenance of the space between the maxillary and the mandibular teeth is very, very important. Okay, so why this occlusion is very much intimately involved in the function of the TM joint, now you can understand, isn't it? So during chewing also, anything which is come in between the teeth only, okay, the forces which are creating with the maxillary and the mandibular, that force is transmitted to the temporomandibular joint. Okay, if you chew any hard thing, you can feel the pressure at the temporomandibular joint, isn't it? If you can eat any soft foods, you can't feel such kind of things. isn't it? Though contact of teeth in between them, so limited stress or limited pressure is transmitted to the temporomandibular joint. Okay, so this is about the dentition in relation to the temporomandibular joint. So the dental factors also have some influence on the functions of the temporomandibular joint. Their position and size of the teeth are also very important, and the contact of the teeth, all these three factors have some relation with the function of the temporomandibular joints. So any deviation to this normal dentition will also affect the functions of the temporomandibular joints. If all present in a regular pattern, then the stresses which are created in the temporomandibular joint is less. If there is anything deviation to normal thing, then definitely the stresses in the temporomandibular joint and the tissues around the temporomandibular joint are affected. Okay, this is about the dentition in relation to temporomandibular joint. In the next session, we are going to see the dysfunctions of the temporomandibular joint. Thank you.